a more than 26% drop in overdose deaths, representing about 30,000 lives saved. That's the headline of a Centers for Disease Control report released May 14th. I'm working from updated data released on June 1st. It's the biggest one-year reduction in deaths since the 1990s, and follows a general drop after deaths spiked during the COVID pandemic. In 2024, only 2 states saw increases, South Dakota and Nevada. In West Virginia, the state with the most significant drop, the number of deaths fell by nearly 42%. Illinois and Kentucky saw a decrease of 28%. Tennessee, nearly 1/3 fewer overdose deaths. Missouri landed closer to the national average at 27%. Experts are already warning that changes in federal policy risk undercutting those gains. This week on the Crossroads Suncast, the forces driving that shift, the work being done on the ground in local communities, and the political fight over the future of healthcare. I'm Bryce Patterson.
Narcan is not a new drug. I mean, Narcan has been out. I've been in EMS for 30 years, and I've used it my entire career. So it's nothing new. It's just it's come to the forefront because of our opioid crisis.
That's Executive Director of Mercy Regional Emergency Medical Services, Jeremy Jeffries. He says, oftentimes when his crew arrives on the scene of an overdose, naloxone, popularly known as Narcan, has already been administered.
The way an opiate works is it depresses your respiratory drive. In the center of your brain that makes you breathe, it puts a blockade in there, like a wall, if you will. What the Narcan does is takes that wall out and allows your respiratory center of your brain to tell your lungs to move, right?
The growing prevalence of Narcan has been a major shift over the course of his career. Alongside first responders like firefighters and police, Jeffries says everyday people having Narcan on them saves lives, and it's not just for cases of illegal drug use.
A lot of our elderly people have had pain in their hips and backs for years and years and years, or arthritis and things like that cause them to be on opiates. They forget they took their medicines in the mornings, and then they take it at noon again because they think they forgot, and that'll be an unintentional overdose.
Carol Johnson is a senior fellow with the Century Foundation, a think tank based in Washington, D.C. She says receiving Narcan to reverse an overdose can be a transformative moment in an addict's life.
It is often, for many people, the pathway to getting to recovery. It is that experience of having a opioid overdose reversal. You know, it may not be the first time, but at some point in time, many people see that opportunity as their first interaction, maybe with a peer support counselor, someone else with lived experience that tells them their story. And then they say, okay, I'm willing to get into treatment.
On the federal level, the Substance Abuse and Mental Health Services Administration distributes kits nationwide and trains first responders on how to use them. It's one of the programs potentially facing cuts from the Trump administration, which has proposed cutting its $56 million annual grant. A similar initiative under the Biden administration allowed federal money to go towards buying and distributing fentanyl test strips to avoid accidental use. Experts say another major driver in cutting overdose deaths has been broader access to addiction treatment. That increase in access has come in part from expansions to Medicaid. The Affordable Care Act's Medicaid expansion opened up eligibility for Medicaid coverage to nearly all adults with incomes up to 138% of the federal poverty level. It also provided additional funds to states that accepted that expansion. Here's why that matters.
Medicaid is the backbone of substance use disorder treatment and mental health treatment, the largest payer of behavioral health care services in the country. And it's very important that those services are available, and they're only available, particularly in rural areas, when there's a solid, reliable payer.
The Trump administration has made major cuts to public health funds across a range of areas in an effort to slash federal spending. That includes pulling grant funds from both local and state public health departments. In Illinois alone, those totaled $125 million in lost funds. The GOP budget currently under consideration in the Senate includes potentially massive cuts to Medicaid. The version passed by the House included $600 billion of cuts to Medicaid funding. Those cuts come in a range of forms, including tighter eligibility and work requirements. Johnson says those changes risk undoing the strides made in fighting overdose deaths.
You're ready to get into substance use disorder treatment. Now you could lose your Medicaid benefits if you don't file the paperwork in time to get your exclusion. If now they're going to check your eligibility multiple times. And so you have to keep proving that you are Medicaid eligible. I do that with my employer once a year and it's burdensome. People could lose their coverage. There'll be new copays, $35 copays for some populations that have never existed before.
Those cuts can also have knock-on effects across communities, especially in areas with smaller populations that have fewer specialty treatment options.
Medicaid is part of the funding infrastructure that makes rural hospitals and rural healthcare providers possible. And so if you draw back resources from a primary funding source, the places that are going to feel it first, you all know this happens on so many fronts. The places that feel it first are rural communities. But the size and scope of it, when you're talking about hundreds of billions of dollars coming out of the healthcare system, that is going to be an immediate impact on rural communities' ability to sustain hospitals. It's already challenging today.
According to the nonpartisan Congressional Budget Office, the proposed changes to Medicaid would reduce the number of people with health insurance by nearly 11 million over the next 9 years. Republicans are split on the bill. Kentucky Senator Rand Paul has called the Medicaid changes in the legislation, quote, bad strategy. But he says work requirements for Medicaid could drive able-bodied people back into the workforce. In an op-ed in the New York Times last month, Missouri Republican Josh Hawley called those cuts, quote, morally wrong and politically suicidal. Hawley also referenced the risk to rural hospitals. According to reporting from The Hill, 10 rural hospitals closed in Missouri in the lead-up to that state's Medicaid expansion. Since that expansion was approved in 2020, there have been 0 closures. Moving forward, settlements from corporations that drove the opioid epidemic are set to provide new sources of funding for treatment. In March, Purdue Pharma filed a new bankruptcy plan, finalizing a proposed settlement of more than $7 billion. The makers of OxyContin, that money would go toward opioid addiction, treatment, and prevention programs nationwide. Critics say that deal lets the Sackler family, owners of Purdue, off too easily, allowing them to keep billions of dollars. Kentucky Attorney General Russell Coleman finalized a $110 million settlement with the grocery chain Kroger earlier this year. According to the suit, Kroger's more than 100 pharmacies were responsible for pumping opioids into communities across the state without reasonable safeguards to prevent addiction. That money is earmarked for addiction programs in communities across Kentucky. Illinois is also set to receive a $40 million settlement from Kroger. President Donald Trump declared the opioid epidemic a national public health emergency during his first term in 2017. That designation continues today. The current Trump administration has said fighting overdose deaths is a priority, despite those cuts to healthcare spending. Instead, policy has largely focused on stopping the supply of drugs, including fentanyl, from flowing into the United States. President Trump has used tariffs to push China, Canada, and Mexico to crack down on the movement of fentanyl. He's also increased military presence along the U.S.-Mexico border. Despite the major strides made since the pandemic, drug overdoses remain the leading cause of death for Americans aged 18 to 44. There are still promising trends, though. Research shows younger Americans using less drugs overall and less risky drugs when they do. And experts say the fentanyl sold on the street today is less potent than it used to be, reducing the risk of overdose. Reporting for this episode by Taylor Bryan and me, Bryce Patterson. Video and sound by Ethan Patterson. Thank you for listening.